Welcome to an introduction to telehealth and really just kind of thinking about the ins and outs of technological proficiency and kind of how we will deliver these kinds of services. I will say that this talk was based off of prior things that we've done, so it will have a more of a tilt towards psychology and behavioral health implications. So just take that for what that means to you in terms of reviewing this video. So a fair amount of this content was previously developed by PCIT faculty and staff, as well as we've adapted some materials from Dr. Jonathan Pearl, who's a telehealth expert at Midwestern University. So our goals really are for you to be able to explain 3 ways that you can increase your technological proficiency to deliver telehealth services, that you'll be able to describe 3 different strategies for helping parents or caregivers structure the environment for telehealth sessions, that you'll be able to identify 3 techniques for conducting the telehealth session. I don't have any relevant financial disclosure related to this presentation, other than I am an employee of the University of Miami. Again, with acknowledgements are kind of where we had our adaptations from this. So Dr. Jonathan Pearl, super helpful in the development of this. A lot of our materials come from or adapted from American Telemedicine Association. And then also there's some forms that are adapted from Telehealth Rocks, an initiative out in Kansas. And again, much of the concepts of this, as well as kind of the things that we've learned are through trial and error that we've done within PCT 305, where we've been delivering telehealth services for a few years. I want to be really clear in terms of noting that this was created for use by faculty, staff, and trainees at the Mailman Center for Child Development at University of Miami, Miller School of Medicine. We just want to make sure that whatever you're doing, including the things that I'm talking about, is making sure that all of your telehealth or communications are aligned with your organizational policies, including laws and jurisdiction requirements as it relates to this practice. I want to keep in mind that while this is going to be more focused on person to family, that we are also providing diverse services across our center, and some may be thinking about how to do this in a group format or parent workshop format. This talk is really dedicated to the service side of things. It's not as focused on things like teletraining or telesupervision. And we really view this presentation as a starting point for things that you need to think through as it relates to delivery of telehealth services versus this, like, well, I did a quick training. This is my ticket to the Wild West of telehealth. We want to make sure that if we are moving towards supporting families in providing this kind of service, that we do that carefully and we do that ethically as well, and that we're working towards developing competence in this area if it's something that we don't have. And when I think about kind of the different things that you want to be thinking through is so one, this is just a quick crash course, is what are the laws and regulations that apply to telehealth, and given current circumstances, those things may change very quickly. What are the internal policies and procedures that guide clinical practice as well as telehealth practice? Business model is something that I think is really emerging as it relates to telehealth. In terms of privacy and confidentiality and making sure you're using secure communication. Is there a business associates agreement in place between, if you're using video conferencing software, and the company that's hosting that for you? Through the University of Miami, we currently have that for Zoom, and we also have that for Skype for Business. And then if you are not super tech savvy, or just this is a new modality, what are the mechanisms for tech support? Who is it going to be to provide support, or is it expected you'll be your own tech support when things go wrong? And things will go wrong because, this is something that is oftentimes new for a lot of different families. I think the other part is, if you're going to be providing getting initial training, but also ongoing consultation as you're delivering this model. How are you moving towards proficiency? I think that this is something that the field is trying to figure out, is what are the actual behavioral anchors for competency as it relates to telehealth delivery, and who are going to be some of your agency champions or people that are really well versed in delivering this way that you can lean on to help in terms of the delivery of telehealth services. And then really be thinking about who's going to be served in this process. Under what circumstances are we going to potentially serve people? Is this going to be a standard of practice? Is this going to be an emergency backup thing? When and why are we doing it this way? Uh, the literature is really still very much emerging in terms of the effectiveness of telehealth practices. So if you're wanting to do this in one way, like a starting point might be looking to see what the literature is that exists. And also thinking about, if we didn't provide this, would this family be able to receive services otherwise? So if, let's say that it's unknown, or the effectiveness of the service is less, then you have to take into consideration as well, a smaller effect size is still better than no effect size, and take that into consideration with your training. You also need to provide training for the families on how to use and kind of the expectations, because how they use video conferencing is probably more in a social element, and this can be somewhat different depending on what types of services that you're attempting to provide. And who's going to be the tech support for them? Is there going to be a designated person on your team that the family can call if they're having troubles, or is it going to be you as the provider? Those are things that you need to figure out before you even start. And while technology is built for a specific purpose, the public really will figure out innovative ways to use it that's usually beyond the scope of what things were normally programmed for. And a lot of times, as it relates to this, you really don't know what you don't know. So we're hoping that this course that you're listening to or watching right now will give you some sense of things to think through. So this is really thinking about planning for delivery. So before you even start, before you're like, hey, I'm going to have a patient, these are some of the things that we really want you to be thinking through at a much deeper level and planning out before you're delivering, versus just kind of hopping in like, all right, I'm doing telehealth starting today. So remember, most of you have probably been communicating with patients via telephone or email. You do not have to just jump to a video conference format of delivery service if it's something that you're not comfortable with, something you feel like you really don't have the competence to do. So if you are comfortable with patient phone calls and you're comfortable with communicating with email, that may be the mechanism that you want to consider until you build more competency in new delivery formats. Just remembering that when you're sending emails, just making sure that they are encrypted in nature, and following university regulations as it relates to that. When we think about things at an organizational level, again, like looking at laws and regulations, I'm going to be talking about some policies and procedures that need to be considered. The business model, again, with we have the BAA in place, and the tech support agency champions. The other thing that we want you to really be thinking through a checklist is what are the resources at either site to manage potential risks that kind of pop up. I'll talk about that in great detail a little bit later on. You want to be very clear about what is the role of the provider and the site personnel. So if a family is used to using video conferencing for just kind of social interactions, you have to make really clear what is expected out of you as a provider, what you're going to be able to do and deliver, versus the things that are now outside. We don't want there to be confused roles. And then we also have to let patients know what we really expect of them. What do they need to do to prepare their own space? What are the safeguards that they're putting in place to ensure that there is security and privacy within their own home? And kind of consideration of safety issues that you want to kind of think about and troubleshoot before you actually ever start services. And getting a sense of what are their own preferences, right? So we think about patient-centered decision-making as kind of how do they want to proceed with doing this. Some of the things that we deliver as services, it may not be developmentally appropriate to trying to administer, some types of tests via video conference, or just we may not be able to see children in the way that we need to really have a true understanding of diagnostic considerations. But there are some benefits of delivering service waves where you do get to see families in their natural environment, which can be helpful. Oftentimes, when they come to your office, you only see what they tell you and what they present to you. But when you're in your home, you can get a much broader picture. So it can give you a lot more rich information that can help you actually with service planning. Thinking about the referral question, like what is the scope of services that you're trying to accomplish through this? And can that initial assessment be completed through this format? Have we received the appropriate consents to actually be able to provide service? And I think it's really important for each discipline is to really consult your discipline's professional guidelines as it relates to best practices for telehealth, which most practices have some kind of guidelines, and we have created kind of a resource folder for you to get at that. But again, I would check your own discipline and your own accrediting bodies related to that. We talked about this need for training and consultation and proficiency, but I think the other thing to think about this is culturally providing culturally competent care, and that is also kind of like a emerging thing as it relates to services via telehealth. So in any given individual, they may have more or less. So we think about sometimes like home visiting programs. Some families are just very resistant to people coming into their homes and being within their personal space. And when you're bringing a video camera into their home, it's also the same thing as where you're coming into their personal space. So I think it's good to explore and just kind of ask families what they think about getting services via this format, and do they have any positive or negative thoughts associated with that. And then also the American Psychiatric Association also has a nice survey that can help you with kind of asking questions in a culturally sensitive way or a culturally rich way. It's the cultural formulation interview. You can Google that. It's open source. It's part of the DSM-5. It can be a nice way for you to be able to ask about some of these questions in a way to gather more information from that individual's perspective that allows you to assess based on their perspective versus you bringing your own biases into the picture in terms of overestimating or underestimating the value of culture as it relates to the presenting problem that you're providing services for. When we think about the room requirements, is that we want it to be a large enough space for 1 to 2 adults or for the amount of people. So if you're seeing a family, you need to be able to see that. Part of that is camera angles, which we'll be talking about. Are you in a room where sound spills in? So I'm next to an office where the person likes to play music pretty loudly, and that could be pretty distracting. Or if what I'm saying is leaking out and people can hear the things that I'm saying, then that becomes a HIPAA violation consideration. Same as it is within people's homes, is this notion that where's everyone else in the house? Do they share space with other people? And to what degree can they have privacy in terms of sound? So that's where you're thinking about, like, are we wearing headphones? Are we not wearing headphones? We're going to be thinking about how can we decrease potential distractions. So you think about a lot of the places we provide services in stripped down rooms where there isn't a lot of stimulation. But when someone's in their home, hey, like I can go hop on my iPad and play games, or all of my toys are in my bedroom, but you're wanting me to sit out in the family room where there perhaps are no toys. So those are all things that you need to be thinking about. You need to be thinking about accessibility as it relates to disability, in terms of, if anyone has like difficulties with use of technology, or if there's anything related to disabilities related to hearing or vision that may impact this format, and just kind of thinking about how you can deliver services sensitive to those needs. Lighting is a huge thing, depending on how you're doing. Is if you think about when you're taking a picture, you want the sun in front of you versus behind you. If you're taking a selfie, right? So if we see this picture at the bottom, we'll see the one on the left is really, it's a lot darker and it's a lot harder for the person to be able to see. Whereas if you have brighter lighting, again, it makes it easier for the person on the other side of the camera to kind of really see what's going on and have a better understanding of the environment. And then you want to really make sure that if you're using any kind of toys or any kinds of materials, that those things are already in the room at the start of the session. And then I think the other thing to really think about is how we share visual information is different. So someone holding up a piece of paper to a camera, while it still can show stuff, is most things now, if you have it in a PDF form or some type of spreadsheet or some type of chart, is that you have those things available on your computing device. And we really want to use a share screen function for that purpose. And we also want to keep in mind, so if you look at the graphs on the bottom, those are actually pretty small, and we want to have a sense of the patient screen. What are they using? Are they using a tablet? Are they using a phone? Are they using a computer, a laptop? And if they're using something with like a little 5 or 6 inch screen and you say, hey, I'm going to show you this tracking spreadsheet, it's going to be so small on their screen, they're really not going to be able to see what it is. So when you're providing service, you need to think about zooming in and out as needed, so that, and checking in to make sure that they actually can see this. Because you're going to be using a share screen function, you really need to remove all notifications on your computer. I think I logged out of my email, but hey, we may hear some dings during this. So all of your notifications or things that could serve as distractions or suggest that perhaps that this is not as private because you see other people's names popping up on the screen that are available to chat or something like that. So it's important that you log out of all programs not relevant to the session, and you remove any potential confidential information saved on your desktop or the home screen of the device that you're utilizing. When we think about ethical considerations, is again, you're going to hear me say competence a lot. I think it's important to really talk specifically to the limits of confidentiality, both on the provider side as well as on the patient side. And some of that you don't know unless you actually ask questions about who's going to be home, who's going to be present, who is likely to potentially come in during this time. What are the things that we're going to talk about when those people are present versus they're not? Really getting informed consent as it relates to what they can expect in terms of the scope of services. What are we going to do in case of emergencies? Because it may be different of how you deal with an emergency when someone's sitting in your office versus if they're down in Homestead, 30 miles away from you. If there's going to be a supervisor or a trainee observing, that should be a part of the informed consent process. And we want to make sure that that supervisor or trainee, that they, when they're observing, that if they're joining as a part of a video conference, or if they're going to be sitting in the room, that the patient's aware of that. Or two, they have no video on their own screen and they have it muted. If you're recording anything related to that, just kind of where's the storage of that electronic protected health information going to be? Compliance with all laws and regulations. This is the tricky part with telehealth, is that you may normally be serving a family that lives in Florida. And they're like, hey, we're going to go on vacation to New York for a couple weeks. And you need to be able to check per your discipline and per licensing, and sometimes looking at that state of whether or not you can actually provide services to somebody outside of your state, or if they've gone into international territory, like what that means. And those are all things, right? And the maltreatment reporting laws, for example, might be something that's very different in other places. So if they're in another place and something happens versus here, like what does that mean? So these are some of the things where it can be tricky, where you may even say, I will provide service when you are here within this state, because you're just more likely to know the laws and the jurisdictions and the things that you need to do within your current jurisdiction of practice. Obviously delivering service cultural sensitivity, and then also thinking about like the boundaries or multiple relationships. Again, they use these video conferencing for social elements, a lot of people, and you don't want them to have any type of confusion as it relates to that. We really want to be thinking about risk assessment and safety planning before you even start. So kind of what are some things that you plan on doing? What are you, the provider, going to do? What do we expect the patient or participants to do on their end? What are we going to do if things kind of get cut out? And we want to be clear that telehealth really is different from face-to-face. So if we think about, like, maybe if something goes wrong, or a patient leaves us, they may, be able to calm themselves down or a cool down period before they get back to a place where maybe there's a person who triggers them. But really, when they pop off a telehealth call, like, they're with each other. So if there's high intensity there, like, they may still be like emotionally charged at that point. So that's why you have to do a lot of the safety planning up front. Or if they get so upset that they just like hang up on the call in the middle of the call, like, what do I do with this? So you need to talk to them up front, like, what are we going to do if we have concerns about abuse or any kind of child maltreatment? What are we going to do if there's any substance use I observe or I suspect? If there's anything related to suicidal or homicidal ideations or plans, or if there were to be a medical emergency or someone gets hurt during the session, how are we going to handle those situations? And those are the things that you want to talk through with them really before you start delivering services. So as you go through this and you're thinking about these things, is like, one, so if we have to think through all those things, like, is this really appropriate for the patient? Is this technology going to work for it? Is there site factors that play into the patient's safety as it relates to it? Do we have development of an emergency contact list in the event that things get hung up? I try and call them, I can't get a hold of them. Who is the person I can contact to check in and make sure they're okay? And make sure that we have that documented in the electronic health record, or we have that documented in another place that's easily accessible. And really just having like a step-by-step plan for detailing this and having these expectations up front so that it's not a surprise to the family when something like this does happen. So when we think about it, you want to establish those phone numbers and addresses of where they're going to be. And really, we've had this happen where someone says they're going to be someplace, and then when we deliver a session, they're in a completely different house. So like, oh, I just decided to do it here for this. So you have to be very clear that you will only provide services when they're in previously agreed upon places. Get those emergency contacts to the community, have all that info readily available, establish the criteria with the family of what constitutes an emergency versus like a write down and we'll talk about it later. Part of this, I'm going to be talking about structure and environment, is getting a sense of the place that you're going to be providing the services and considering things that could be a risk during the session or things just generally could be a danger, like if the child starts climbing on something. This is tricky, right? Because not all of us are trained to be experts in injury prevention, though a lot of us go to trainings on this. And then what do we do if the provider's available, and what do we do if they're not? We're going to write this down. We're going to share it. Ideally, you want to have any kind of safety plan. You want to have the patient actually sign off that they agree to it, but you want it agreed to verbally and in writing. And then they get a copy, and you want that kept someplace that they're not going to lose it. And then you're going to keep a copy as well. And then within your notes, you should be documenting that that plan was reviewed and the patient understood and agreed. But it may be necessary to indicate how that patient actually indicated understanding. So again, preferentially, you want to get that signed off on. When we talk about boundaries, so we talk about there could be some confusion when we start delivering services this way. And again, these portions of these slides were things that we adapted with the permission of Dr. Pearl. So we think about boundaries in terms of time, setting, modality, and then there's provider-specific boundaries that we need to take into consideration. So at time, once you start going into this more video-based format, is there may be this perception that they can message you at any time of day. So, that you are expected to message them back as a friend would. They can message you when you're out of town. What do they do? How do you handle this if they arrive late? You're like, how does someone show up late to an appointment at their own home? It happens, and it happens frequently. Or it can be easier to lose track of time of running over the session time. So just kind of making sure you set up parameters about, expectations for time and expectations for the length of that. because video conferencing can be convenient, it's easy to get into this like, well, yeah, I'll just kind of schedule at this odd time, or oh, you need to do it at 7 in the morning, you need to do it at 7 at night. Yeah, I mean, like I have my computer at home, I could do that. So I mean, like it's important to kind of set boundaries of when is going to be your professional scope and time that you're going to be scheduling patients. Which obviously that's dictated by program specific and supervisor specific guidelines. And then some individuals just place less emphasis on being punctual. So what do you do as it relates to billing or counting the service? What are the policies if they're late with respect to that? Those are things you have to take into consideration. In terms of the setting, think about like you're actually you're like virtually entering their home, which may disrupt some of their personal boundaries or make the provider aware of other factors that they really were not aware of. Like, so maybe it's an unkempt home, or hey, I forgot to ask how many people were living in the home, and when I see this, there's a lot more people, or it's clear that maybe there's housing insecurity here, or hey, it's just really loud. So there's a number of different things you can learn, and you just have to keep in mind that you're going to learn that, and you want to be upfront with the family of like, I just want to be clear, like when we do this way, these are things that I may learn that if you were doing this in an office-based format, that perhaps you wouldn't have considered telling me. But you can also frame it how it can be really helpful because you're going to understand the context that they're trying to deal with things. So typically, so social, in terms of how we do things, like I think this is less of a concern as telehealth becomes more prevalent, but patients may over disclose. We may be overly friendly. We have to remember that this still is a professional interaction, but there also can be really distracted communication. So again, if you haven't turned off all the notifications on your end, and if you have a bunch of things popping up on your device or on your laptop, that's distracting, or they may be getting notifications during session of like, where, oh, I have to take this call, or can you wait a second, I need to return this text, because they're literally using like a device for those purposes, and you need to keep that in mind. Providers, again, I think we have to be very clear in terms of what we're going to be providing as it relates to the service and what we're not going to be doing. It also, I think, lends itself to providers feeling like they can work at inconvenient times. So, well, yeah, I'm sick, but like, I really want to see this patient. So from home, I'm going to go ahead and see them anyways. But like, if you're sick enough to not be at work, you probably should not be delivering services because you're not providing the best possible care. Or you may be attempting to work from inappropriate locations that might be issues as it relates to privacy. So, I mean, people could be trying to deliver a session while they're driving in a car, while they're sitting in a car in a parking lot where someone could just walk up and see and that you're on a phone, from a location where others are present. So, oh, I'll just do this session from Starbucks, where there's other people just kind of walking through. On vacation from a place outside of practice jurisdiction, or where you're trying to use spaces that have free public Wi-Fi that's not encrypted, that may risk the patient seat. So even when we have like this end-to-end encryption, when we're using secure video conferencing, but I do think it's one of those things that you have to take into consideration with respect to, we want to make our interactions as secure as possible. So making sure that we are utilizing the most secure connections as possible. So when we think about really prepping about that first appointment, we think about kind of how is informed consent going to look a little bit different? Does your agency, so has a specific telehealth consent, safety planning document, you got to be working through that, and then consenting them for other types of electronic communication that you might be providing. If it's something where you're going to be providing them with equipment or any types of devices, giving them some kind of equipment checkout form with an understanding of the agreement. So this is just a quick thing. The UHealth has a telehealth agreement. I think that one of the things that are super important with the standard UHealth consent is that it talks about that no audio or video recordings of the telehealth encounter will be made or stored by the university. For some of you, for training purposes, you may be recording that. So you just want to be very clear about that. Or it may be something for your clinic where you need to take that into consideration with respect to the consent and remove that from the consent. Again, getting that safety plan in place and kind of signed off. Equipment checkout form, this is something that each program, if they're using this, they should have that, and kind of what is your process for checking it out versus checking it in, and what happens if it's damaged or stolen or whatever. In terms of text messaging, just making sure that if you're seeing patients through encounters through UChart, that you're using secure chat, which is encrypted. Sometimes we have programs that are not within UChart at this point in time, so they can't use that for those purposes. So what we'd like to see for that is you actually getting consent for those other forms of communications, and then what the scope of those communications are going to be. Generally speaking, you should not be providing care via text message. It should be something that if you need to set up a time for a phone call or you need to confirm an appointment, those are the things that you should be doing outside of that if you've consented someone for that. If you have not, you should really stick with phone calls. So if someone, for whatever reason, you gave out your cell phone and somebody texts you, I would advise you to call them back or email them back with a secure encryption if you don't have those consents signed. So when we think about everything and we're getting ready for that first visit, have we actually downloaded the equipment? We like to have people actually test out whatever the app is. We're likely going to be using Zoom quite a bit. So I would suggest you actually do like a test Zoom session with somebody else before you try and do this with a patient for the first time. Because it's just something that really can get, like, if you don't know what you're doing and then the family doesn't know what they're doing, it just becomes an utter nightmare. Making sure that you have tech specs and compatibility of all of your equipment, that you've made sure that whatever apps you're using are as updated as they can be, or if you're using Bluetooth devices, that they're actually compatible with the equipment. We've had the issue where we've ordered Bluetooth headsets that weren't compatible with our iPads, and we didn't test them out, and we sent them home to families. We're like, all right, well, that's not helpful at all. Making sure you're using video conferencing software with the share screen option if you're going to be sharing things like handouts or brochures or sharing test results or any kind of feedback. Consideration of session recording software. So Zoom has built-in ability to record, but you can use other things to record if you need to. If you are recording, again, you want to make sure that you have consent to do that. It is illegal in the state of Florida to record somebody without their consent. So please, please keep that in mind. If you are recording, make sure you test that recording and then it's actually capturing all of the sound and there isn't weird echoes before that session. Make sure that you have a functioning webcam. If you're in a private space, I would still say you should put up a do not disturb sign. I have one on my door right now while I'm recording this because you don't want people knocking on your door. If someone has access to your space, they may just open and then all of a sudden you have someone else in your office space. If you have shared space, just making sure that either one, you're using a designated telehealth suite, which we have one on the 5th floor in Mailman. We also have one on the 4th floor that's used for PCIT purposes. But if you have share space, that just you've really talked through with your office mate of what that means in terms of delivery of services. If for some reason, and again, this is specific to the program, you are delivering services remotely so that you are not on the premises of UM and using a UM secure internet connection, it's just making sure you connect through a VPN if you're remote, just to make sure that you're making your connection as private. Even if your own home network is secure, I think it's important to use that. So that's through remote.miami.edu. You don't want a lot of clunky, choppy video. So making sure you have stable, high-speed internet connection, just Google internet speed test, and there's lots of options so you can get it on device apps for your mobile devices for those things as well. And because sometimes audio will fail or things are freezing, you really need to have a phone with a speakerphone or a headset or the ability to put on like your own ear pods or AirPods or a headset that has microphone capabilities as a backup option, because if things fail, you got to change things quickly. When we think about setting things up for the family, this is a big thing. Just make sure that everything's charged. Just make sure that it's charged. And if you're giving them equipment, I would say give them equipment where there is a 6-foot charging cord, because if you're stuck with one of those little 3-foot charging cords, because they forgot to charge things, you may not be able to have the camera angle that you want for delivery of services. Make sure that on their end that the webcam or tablet or device that you're using is compatible with the video conferencing software. We like to, so if you see kind of the Bluetooth headset down in the bottom right corner, is one of the things that kind of comes into mind with that is we like to use cheap Bluetooth headsets, because then we can hear the parent and the child talking if it's something, if you're using a coaching model. Obviously, if it's more of a family discussion, you may not need a Bluetooth option, but it's also something where if there's other people or you need to talk about more sensitive things, you may want to switch to a headset thing for those individuals. But then you also have to get to understand where the other individuals are, so you really have some sense, because you can only see what your camera shows you. So for all you know, there could be, let's say you need to talk to an adolescent about risky sexual behaviors. Their parent could just be sitting behind the camera for all you know. So you need to get a sense and have a talk about those things in terms of, how you're going to be able to have those kinds of private conversations. You see a variety of mounts that we provide. So it's not someone just holding their camera like this the whole time. So think about that and ways you can do that. And then making sure the family understands what the private space is going to be used within their own home for session purposes. And that is if you have a child that has behavior problems, that you're within a space within the home where there's an opportunity to really respond to those child behaviors, or that it's set up in such a way that, you're like, well, the quietest room in the house is the dining room where we have all of our fine dishes. So we're like, okay, that might make sense from a privacy standpoint, but if your child starts acting up during session, that's probably not the best place in the house that we want to be in terms of like destruction of property and safety. We also want families to have stable, high-speed internet connections. You also want to talk about, we don't know, if we're assuming that someone has Wi-Fi, as a part of your informed consent process, is you need to get a sense of what level of data. Do they have unlimited data if they have home Wi-Fi? Is it capped after an amount? We don't know how much data each session is taking, but you want to make sure that, like, while you're providing a service way, that there's not some random extra charge that they're going to have from their internet services or their mobile services related to that, or just reminding them to be on Wi-Fi in case they forget. And then just making sure that if they're using a phone with a headset, that there's compatible adapters. For most of you know that Apple switched to now you have to use the lightning cable. You see the little adapter we have down at the bottom on the right side. So just making sure that they have the appropriate adapter if they are using some kind of headset for that purpose. And it's really helpful to give written and video step-by-step instructions. We've created guides for PCIT purposes, but I would also just suggest that that this is something that we really view that you're going to have to adapt for your own program. But the more that you can have step-by-step instructions, the more helpful it can be. We also would advise that before you actually try and deliver services, that you take 15 to 30 minutes to schedule a tech setup session with the family before actually starting to deliver services. So let's say that, like, your general session time that you have with somebody is 15 to 30 minutes, and you have patients scheduled every 15 to 30 minutes, and you don't do this tech setup. Well, when you contact them and you're spending the whole time just doing a tech setup, people are going to be really upset, because the thing they wanted to spend their time talking to you about, they're not actually able to do. So taking that extra time to do that. And you really need to figure out who's going to be that staff member that's going to do that. Is it going to be you as the provider, or is there going to be a point person on your team that actually will do some of that if that's something that you're not available to do yourself? Because people get really frustrated really quick if the tech doesn't work, and this can be a reason why people will either stop services or look for services elsewhere if they don't feel like we have our act together in that department. So trust me, take the time to do the tech setup with them ahead of time before you're delivering services so you can troubleshoot those things in advance. Before the session starts, we have to be thinking about how we're actually going to structure the session. Kind of like we have to prepare for any of our cases, there should be things that we're not doing on the fly that we're doing in advance. So it could be starting early that day or the prior business day. If there's forms that you need from the family, they need to be returned prior to the start of the session. If there's handouts you're going to be going over as a part of some type of education, those need to be sent in advance. Unless you don't want them read in advance, then you should have it set so that at the end of your session, you're going to email them those resources right then and there so that they have them. It's easy to forget if they're not physically there. If they are returning measures of some sort that are scored, the family need to meet established deadlines for returning forms so that you have an opportunity to score them before sessions. Before signing into the session, they should open on their computer the provider, digital feedback that's going to be shared, the test assessment results that are going to be shared, and then contact numbers for family in the event of emergency. The therapist should close on their computer or their device, notifications for email that will make noise or have things pop up on the screen that, maybe another patient emailing you. And if you're sharing screens, that's going to be a problem. Remove sensitive files or folders from your desktops. You see down in the bottom left, I have an example of, a folder, super inappropriate folder. You don't want to be accidentally disclosing things or having HIPAA violations because you're sharing your screen and sharing the wrong stuff. I will also say don't skip steps if patients haven't completed what they're doing. So as part of laying out the expectation for services is if they haven't filled out the forms, I will say you may have to cancel that appointment, or you would say, we can't start this appointment until you do those things because I need those things so I can engage in next steps. And, sometimes that's going to be problematic, but if you hold them accountable on that, then it makes it easier. Whereas if you let it slide one time, they're likely to do it again in the future. So it could be something like, okay, well, you know what? I'll just wait on this call until you're done. You send it and then I can take a look at it. Or just call me, here's the phone number I'm at. Call me when you're done doing this and we can reconvene the session. Or if it's something that's going to take a long time, be like, we're going to have to reschedule. So I think that's important to talk through that as well. Start of the session. So you want to check in, and this is going to vary by the modality in terms of what you're doing, but check in with the provider camera on. Depending on the delivery, you may have your camera on or off during certain portions of a session. It is something that, depending during that initial check-in when you're talking to like, hey, how have things been going? You're usually talking to the parent. If they have the camera right up to their face, like it may be more difficult to see the child behavior. I think it's still important across anything, just reminding the parent, hey, just kind of like if you're on a phone call, praise appropriate behavior during check-in, or they may be able to describe what the child is doing, so you have the opportunity to tell them how to praise them as it relates to that. If you have someone observing the appointment, you need to let the family know who that is. If you have someone that is joining via video conference, again, they need to be identified, but that person that is just there for observation purposes, they should have their video and audio off. So they should be muted. So they're purely in an observation role and they're not interrupting the flow of the session. If for some reason you are conducting behavior observations, you need to keep the camera off and the microphone muted. Sometimes with video conferencing, there can be an echo because you're trying to make sure you have good enough sound. What we have found that if you're talking and your volume's up really high on your own computer, is if an echo emerges, that if you turn down your volume some, a lot of times that echo will actually go away. If you're engaging in a coaching activity, in order to not distract the child, we find that keeping the camera off during that time is super helpful. And when you're doing checkout, if you were doing coaching, check out with the camera on. Again, share screen to show results if you need to. A big part of how we really kind of set things up for success is really thinking about the camera angle, and getting that camera angle right early can be a big difference. So you need to be thinking about, if I was delivering this in person, who would I want to be able to see? What environment would I want to be able to see? And take that into consideration in terms of, so this is part of your tech setup session is, for example, PCIT, want to be able to see interactions going on. And if I can only see, the parent's face up close, I really can't see what's going on. And it's going to limit my ability to be effective. Or when they're showing you the space, like kind of looking at, okay, well, this is a bigger space. But it looks like just from this camera angle that I have right here with the one where it's showing all the toys on the ground, is the notion of, well, it looks like the child's clearly not going to be contained within that environment. So I may want to take and bring the camera back a little bit further. And depending on whether the parent has a Bluetooth, so this is the trade-off with camera angle, is the further you move the camera back, you might be able to see things. But if you're not using Bluetooth, well, then the quality of your audio and what you're able to hear goes down. So those are the things that you want to kind of figure out and test out. I think usually what's more helpful is more of an eye in the sky, or kind of a further back where you can see a broader range. That way, if the parent or child are moving, that you're able to do that. Obviously, if you're delivering something where it's just everyone sitting on a couch, you should be able to have a stationary, camera in place, and it should not be a problem. But if you're working with younger children and they tend to move a lot, you're probably going to want a broader camera angle. So the higher up you have it, so it's out of the child's reach, the better. And this is why, another reason why we like to have that 6-foot cord, so we have a little bit more flexibility in terms of where we can put tablets or devices that are being used within the home. We also like to really explore the space to the extent that the family will allow. So it allows us to kind of, most mobile devices, they have a rear-facing camera and a front-facing camera. The rear-facing camera is usually lower quality than the front-facing camera. The rear-facing camera is the one that you use for selfie purposes. But it allows you to, so if you have them swap to the front-facing camera, it gives you an opportunity to walk around and explore the space while talking to them, so that you can identify potential hazards or privacy issues, or things that might come at the cost of safety, or things that are delicate within the environment that perhaps we want to avoid. And we like to have the parent just kind of take us on a walking tour of, like, here's where we think that things are going to take place for the session. You want to get a sense of where else they might be thinking, or even, like, if you're advising them to try something out at home, having them walk around and tell you about where they're going to be doing this while showing that allows you to troubleshoot, because you're actually able to see them talk about the space and actually physically see the space, which can really help you with figuring out the best way to have them implement whatever it is that you want them to implement. And then also it allows you to have a conversation of the pros and cons of delivering services within one space. And the nice part about that is, ultimately, if it's something that's interaction based or parents need to try things out, is you can help them come up with the pros and cons, and ultimately allow them to have some decision that they make about what they think is best, because they're more likely to own that than if you say, yep, we're definitely in the kitchen. We're never really in the kitchen, but the kitchen's in the safest place, so that's where we're going to do it. But the kid's never in the kitchen, right? So you want to think about things that are going to allow whatever you're teaching to generalize to that setting. So that exploring the space can be really helpful. In terms of structuring the environment, it also, let's think about, like, all the things that could potentially go wrong with doing things like this, or that you think as you're trying this out, that would be able to interfere with what we're trying to accomplish during the session, or that could interfere with the privacy of the session. So, like, hey, if you're someone that has Amazon coming and dropping stuff off every 45 minutes, like, what are we going to do about that? Or you frequently have house guests, what are we going to do with that? Or, mom gets home, dad's home, mom gets home from work, and that's usually right in the middle of the session, and that causes a significant disruption. How are we going to handle that? It takes 15 minutes to kind of get resettled and back into session. Problem solving these items before you proceed with services is going to allow you to be far more successful with this kind of delivery. All materials and toys that you need the parent to have, they need to be within the scope of the camera angle at the start of the session. Because if they're not, you're going to have the child leaving the room, the parent's going to need to leave the room, and it really is just going to reduce the efficiency of the session you're able to provide. And if there are other children that are going to be in the home, and this is something where it's like a parent and a child, you just want to make sure on your end that the other children are getting appropriate levels of supervision. And you may have to game plan and troubleshoot with them how they can actually do that. So, what can happen when tech is not prepped in advance? And even when you do really prep tech in advance, there's just going to be issues that emerge. It's definitely a when tech fails versus if tech fails. So when we deal with tech issues, it really is important to jump ship quickly. So like if you're having problems with the video conference, our backup is always just switching the phone right away. You don't want to be spending 10 to 15 minutes trying to deal with or just like you say something that you're not sure how they're going to react to, and then all of a sudden there's a freeze frame where they have like a serious look, but you really don't know if like they're just not responding or if the video frame has frozen. So if you're experiencing those issues, you can see how that could get in the way of the flow of the session. So if for whatever reason it's not working on a given day, switch to the phone. If the video call drops and like they don't reconnect within a couple minutes, just call on the phone. Or if you can't get a hold of them, this is why you have that safety plan, is you're going to have laid out the steps for what you need to do to get in contact with them. Bluetooth connectivity, if you're using that, or if it's not charged, just have a backup plan, whether that's just a headset that plugs into the tablet or it's something that they have a corded headphone that it can do, that's fine. What do you do if the child is like, well, we're doing exposure activities via telehealth, and the child's learned like, well, I can get out of doing this exposure activity if I just, in this video call, right? I can avoid it that way. So it's important that you've talked through a backup plan of what's going to happen when you do that. If it's behavioral, we want to minimize the attention while removing the child's reach or access. So again, getting things up high, if at all possible, for younger children, flipping to the other camera. So instead of using kind of the rear face camera where they can see you, you flip it around so they literally just see the back of the device, which may be less stimulating to them and they may get bored about it. Or within Apple products, there's a guided access mode that really prevents a child from exiting the session unless they have the right passcode, which can be different from the sign-in passcode. So that's another thing. So I would Google guided access mode for iPad or iPhone if that's something where you have concerns about that. In terms of general video conferences as you're delivering these sessions, is when you think about if you have a limited view of the parent and child, take some flexibility. It can be solved with communication. One, it could just be simply saying, hey, just letting you know, I can only see, like sometimes they're not paying attention to what you can see, right? So right now, this is recording is in my mind right now, I see a very big PowerPoint in front of me. I don't see me at all, but I think on the side, there's a very small me. So I don't even know, like if there was something that was randomly going on in the background, I wouldn't know right now unless I turn around or I don't have the video on. So sometimes just a simple conversation to clear up of what you can and can't see. And maybe you need to change the camera angle. Just having the family set expectations in terms of who needs to be in the room and how you're going to troubleshoot to actually keep those people in the room during the session. So if you're doing some kind of family session and the child doesn't like what it's in, they just, I'm gonna storm off to my room. Like, whereas in session, they're probably less likely to do that if it was in an in-office setting. So you're gonna have to work through those issues of how you're going to get them to actually stay in the room. And you may have to provide them some coaching on how to get, maybe it's a parent or a child back onto camera. Dealing with interruptions during appointment. So other caregivers, other siblings coming in, those things inevitably are going to happen when you're delivering services. You have to be flexible. But again, that's why you've come up with a plan with the family of how you're going to deal with this. And again, that plan may vary from family to family how they would like to deal with this. You also need to be really clear of like if you're talking about pretty confidential information, by the time they're in camera shot, like they've already heard what's been said. So those are the things again where you really have to think through those processes in advance. Um, or if it's something like if you have a parent and a child, so like I have, AirPods right here. And one of the things I think about is, and this isn't going to work for every family, is like if you're really having sensitive stuff discussed and there's other people around, like if you have one parent wear the right and the other one wear a child wear the left or whatever, um, it might be that's one way of having it. Or it may be that you have to save those kinds of conversations for a phone call, later when parents aren't around the child and things like that. Okay, but those are all things that you need to kind of consider within your own discipline as it relates to that, and also consulting with your supervisor in terms of what they would prefer for you to be doing. So I know this is pretty general, and again, this was just kind of things for you to think through to get started. We have lots of summary and take-home points here, um, but I think just kind of is really thinking about it like, one, is your program ready for this? There's the technical element from a therapist or a provider perspective, making sure that you're also working through the technical setup from a family perspective, making sure they're equipped so that you're not spending all this time figuring things out. It's really important for you as a provider not only to provide structure to what you're going to be doing, but also structure what you're going to be doing during the session. I can't emphasize the importance, and this is the key, is that, I would love to say that telehealth feels exactly the same as in-office services. It doesn't. We want it to be as good or even better than in-office services. And if you really take the time to structure the environment, and I know that's extra layers, it will make your ability to conduct these sessions so much easier, so much easier. Like this is something we've learned time and time again through delivering PCIT via telehealth, is that if you structure the environment, it really saves a lot of pain and suffering in terms of working through issues later. And then really just kind of thinking about specific session strategies, constant communication, checking in, and just kind of following that safety plan or your backup plan if you have tech difficulties will kind of ease. And I think the other part is just like if you're trying to do secure video conferencing over and over and over again, and you have issues every time, then you have to be like, is this really the right format for this family? Do we need to go to telephone support or other types of forms of support that we can provide via telehealth? And just one final point is just remembering that just like in-office services, telehealth is a continuous learning experience. It's something that is evolving and it changes relatively quickly whenever things are technology based. And it's important for us as we consider new technologies to really be thinking about how do these things fit within, one, my field of practice, within the ethics of my practice, and within current, legal requirements or jurisdiction requirements of where I practice, in terms of state, country, but also within your organization. So I hope this was helpful, and we'll talk soon.